were telling of how you came across this idea of psychological father absence. This was something that you did in graduate school.
It was.
And I, as a professor, have told graduate students, don't worry about defining your whole career in graduate school. There's lots of learning to do. But you actually did. I don't know if you would say that's a fair characterization, but you came across an idea in grad school that has really informed your clinical work, your professional identity for your whole career.
40 years.
Yeah.
Yes. How can I say that? I still agree with you. I don't think a graduate student should go to graduate school in order to find
nail it down.
Seed
Yeah.
that they can use the rest of their life. I think that's an accident. It's luck, it's creativity, it's good professors. It was a university that allowed me to go from department to department without being within one silo of a department. Who knows what it was. But I knew that things didn't feel right from me. Coming from this immigrant farm family background, I knew that the literature, Evelyn Mills Duval on the normal American family, and even Talcott Parsons and some of the sociologists back there, those families I could not relate to. And then I need to tell you that there were two mentors that I had who encouraged my, how can I say, rebellion or my creative thinking. I don't know what you call it. One was, of course, Carl Whitaker in the family therapy area, who just said, keep reading, keep thinking, and he just encouraged the thinking. The other was Professor Reuben Hill, a sociologist, who never was my teacher, but he became my mentor when the Center for Prisoner of War Studies in San Diego asked me to do my dissertation on their data. They said I had a theory, and they had data, and could we work together? So my committee said yes, and Reuben Hill was their advisor, so that's how I got connected to him. He was a Mormon scholar, a Mormon sociologist, and I don't know if students know that we have the Mormons to thank for beginning the study of family. They were the first academics who thought family was worth scholarly work. It occurred mostly in sociology years back. But Reuben Hill also had gone to the University of Wisconsin in Madison, which is a pretty liberal university. And he always talked to me about that and how he loved the liberalness of Madison. And that's where he started groups for married men and who were students, young men, came back from the war, were married and in school. And he got into marriage and family instead of straight sociology. It was Reuben, really, who supported me about getting published. He could have, when I took him on regarding the normative American family, he could have blackballed me easily as a graduate student. But instead, he encouraged me. And I will never forget that. And he would say things to me like, I don't agree with you, but I want you to be able to say this. And I remember we had wonderful arguments about the 8 stages of the family life cycle, I remember clearly. And I said, it doesn't go that way. You don't get engaged all the time and then get married and then have a baby. I said, I know a 70-year-old grandmother who has a newborn. You know, she got it from her daughter who's now on drugs. And I said, where does that fit? And he says, well, we just don't have a theory for that. And I said to him, I think if a theory is good, it should be more encompassing than that.
Than what we've got.
Yeah. And so we had wonderful, I mean, he was ideal professorial type. You could argue, you could wrestle with ideas. Didn't have to agree, but you ended up with equal respect. He was wonderful.
Yeah. You, when I initially asked you if you'd be interested in this, you said something, in doing this interview, you said something like, well, I don't know if I consider myself a researcher so much. Can you explain that, or maybe I got that wrong? Or because I think when I talk with you, you are very dialed in clinically, and you still engage in clinical practice today. And so tell me about maybe is it a reluctance you have to say, yes, I'm a researcher, or because clearly this list shows that you have inspired research. So if you could address that a little bit.
Oh, yes. Well, I think I inspire psychometricians, for example. I'm not a psychometrician, but I know I had two students who really were. Jan Stephen Greenberg, who's now the chairman of the social work department at Madison, University of Wisconsin. Wayne Caron was a psychometrician. That is, they could make instruments, and I just wasn't interested in the detail work of psychometrics. To be sure, there's a part of me who says I don't know that it can be measured anyhow. And so over my career I've argued with, if it isn't measurable, it doesn't exist. Well, I think a lot of things exist that you can't measure. Which then brings me over into the social construction area. Yes, more postmodern. And so I don't think I was the best researcher on this. I think my students have become very, very much better than myself on the researcher. But then that's the pleasure of being a professor, is that your students can better you. And I like theory development a lot. I love it. It's a passion for me. And I like testing of it. Now I don't anymore in my retirement, test it myself. But my real passion is taking the testing results and going back, trying the theory with real life families to see if it works, then going back again and adjusting the theory and so on. The exciting piece right now is that the International Red Cross workers in the field are testing the 6 guidelines that I wrote about in the 2006 book about finding meaning and tempering mastery and adjusting your identity, etc. When someone you love is missing physically. They're working with families where a man or boy has been kidnapped politically. They are doing an excellent job of field testing, and I couldn't be more grateful because they have the means and the youth and the cultural ability to test it in the field. I will be so eager to see their results, and will continue to write about their work as it impacts my work and how I need to adjust it to these new findings from this, what I call, second generation of researchers.
So, so I think that it's, am I too far out of line to say that your theory construction has always been informed by research as well?
Always. But always informed by clinical work too.
Yeah.
I think you don't always find both. And so I'm very proud to say I'm an applied researcher. And I think there should be more of us. That is, who take the research findings from the ivory tower, but take them out into real life and test them. Test them at 9/11 in New York, test them with the International Red Cross in the fields of Nepal or Africa or Sri Lanka, to test them at Columbia with autism, to test them with brain injury with the soldiers coming back. That's the real test. I believe good theory is useful theory.